Professor Allen here. In this video, I'm going to go through the general paper format for using APA 6, 7. Remember, we are respiratory therapists. We are not English majors, but I did think it was probably appropriate for me to go ahead and do another video. So I'm going to go ahead and walk through some basic steps and some key things that I think is important for you to identify when formatting your paper. So first things first, I'm going to go ahead and remove me from the screen here, and you can see the title page right now, which we'll probably come back to, but I want to come down to the actual body of the paper. Now there is another video that talks about the title page and abstract, and I ask you to go ahead and watch that video. But we're going to talk about the body of the paper, formatting your general format for your full research paper. And the first things first is that you're going to want to make sure that you have 1-inch margins. If you come over here and you go to layout and you go to the top left hand side, you go to margins, it should be under normal. If you have anything else that's identified, go ahead, click on it, go and make sure that you've identified normal. That's what you want to have for your margins. Now that's saying that you have the most current version of Microsoft Word. As Newberry College BSRT students, part of your tuition is that you get free access to Microsoft 365. If you're in Wolfden, top left hand side, it give you to opportunity to download for your computer. So I would advise that. But if you want to make sure and check that you have your margins set appropriately, go to the top left hand side, go to layout, go to margins, and make sure you see it says normal. If you don't see that, go down to custom margins, and it should be here top left 1 1, bottom 1, and right 1. So you want the margins to be 1 inch on all sides, and that's what you have going on right now. Your font here, go to home, click over here. I know that I've been saying use New Times Roman or Calibri and do it in 12 font. Well, after reading most current APA 7th edition, Calibri Arial in Georgia 11 font is fine, and you can use New Times Roman 12 font. I would tell you to keep it simple, and I would use New Times Roman 12 font for your paper. You'll get used to seeing what that looks like, and it'll be easier. The next thing too is that you're going to want to make sure that all of your subject headings, your sentences, and your paragraphs, everything is double spaced. In order to go double spaced, you need to go up here, go to paragraph, and right here in the center, you're going to see here, and you need to make sure it says it's clicked on the 2. So when you're on the 2, that's what you want to make sure that you're on. You just want to have everything double spaced. Okay. The next thing is that your paper is going to be left aligned. Now, I have clicked over here. It says align left. That's what you want. Okay. I've called it left justified. After reading it, they said don't use left justified, but I didn't see how it changes the actual format. But it says to use left aligned. So when you click it, you'll see it darkens and it's aligned to the left hand side. Okay, so you go to paragraph and you click here. Okay, your first page of your research paper is going to be your title page, which we went over before. And what you want to make sure you do is choose a title that reflects the purpose of your paper. Use your activity questions that you're using to guide your research. Come up with the title. It might be something with regards to pharmacology, and here I said treating acute asthma. That's the title of the paper. When you read this paper, it's going to be talking about an acute asthmatic and treating them. You see in my running head, I put the title up here. Now I want to make sure that I keep that title, because that title I'm going to use later on in the body of the paper. Follow the format that you see in the other video for your title page and your abstract. I'm going to go down past the abstract, and right here in this template, I'm going to highlight there, and I'm going to go ahead and paste the title that I had from the original title page now. Okay, the title page, the page 1, has the title of the paper as Treating Acute Asthma. Well, that's what I'm going to want to have in the paper. The next thing I'm going to do is, you see, page 1 is the title page, page 2 is your abstract, page 3 goes into the body of the paper. Everything is going to be, we're going to check the font in a little bit, but everything is double spaced. It is left aligned. The first paragraph is indented. The only paragraph that's not indented is the abstract. It's block style. These are called subject headings, and I want you to go ahead and include an introduction subject heading, even though it's not required and it's kind of assumed. I'd like you to put the word in there. I want you to get accustomed to going through the steps like you did for your when you were in your associate degree program, when you were doing your learning to do your treatments and your different types of modalities. You had different steps, checking the chart for an order, then you looking for indications, contraindications, and hazards, gathering your equipment, getting your meds, knocking on the door, introducing yourself to the patient, washing your hands, checking the ID, doing your patient assessment, heart rate, respiratory rate, sat color, level of dyspnea, breath sounds, 4 on the front, 4 on the back, 2 on the sides. You know, you did all of that and you had a sequence. I want you to do the same thing with the paper. I want you to attack the paper the same way you did your clinical checkoffs. So the very first thing is you're going to have to come up with an introduction. Well, where's the introduction? Well, it's a one paragraph in length, and it introduces the topic or the main idea of the paper. It relates to the activity paper question. It generally addresses the activity questions in a separate paragraph. So depending on if there are 3 or 4 different types, 3 or 4 activity questions that you have to answer for a particular module assignment, activity paper assignment, then you're going to have at least in the middle of the body of the paper 3 or 4 paragraphs that are going to be specific to the activity questions. There's probably more, but at the minimum. So again, you want to use the activity questions as a guide. Your introduction is just introducing the reader to your topic and your subject matter. Based on your activity questions, you're going to come up with your subject headings. There are 5 different subject headings in the APA format. I really want you to just be worried about really a level 1, the most important. You can do level 2 too, but level 1 is the most important. If you do that for each one of the areas, it kind of organizes all of your thoughts and the parts of your paper, and it makes sure that it makes it easier for you to make sure that you've covered all of the required parts of the paper. So I know that if I'm going to be looking at treating acute asthma, I need to go ahead and be able to identify. So I'm going to do something on the signs and symptoms for an acute asthma condition. I'm going to answer and find my research. I'm going to go in here. I'm going to get that information. And, do not look at these words. This is a different type of paper. I kind of changed the headings, but these subject headings, this would be a level 1 subject heading. The next one is the actual treatment for acute asthma. That's another level 1 subject heading. It's centered, double spaced, and your subject headings are going to be in bold. You can see there's bold. There's the title of the paper. Bold, bold, centered, centered. Okay? You can see treatment. Now I'm going to get specific. Bronchodilators. That's another subject heading, level 1. Well, what if you wanted to include information that was under the bronchodilator heading, but it was a subcategory? Well, that in the APA format would be considered a level 2. And for a level 2, they would say you follow all the same format guidelines, bold, centered, double space, start the next paragraph, next sentence down, indent it, Everything's the same except for if it's a level 2, a subtopic or a subcategory underneath the level 1 subject matter, then you're not going to have it centered. You're going to have it over here and aligned left. For me, you could do it aligned left, or you can go ahead and center it. Okay, I'm just showing it to you just in case you have it for another instructor. At least you know that you can do it that way. So we have beta 2 adrenergics and pathomimetics. So I'm going to be talking about that drug, talking about all the things that are necessary to answer the activity question that's related to that, and why I would give it to a patient who is an asthmatic. Then I could talk about the next bronchodilator, and here I got an anticholinergic. Well, what if it's an anticholinergic parasympatholytic? Talk about that drug, the same types of things, indications, contraindications, hazards, how I'm going to give it, how often can I give it, what are some of the things I need to be concerned about. Next subcategory is, this is really not a bronchodilator now, okay? So the corticosteroid is not a bronchodilator, even though it might, depending on what you're using, have some bronchodilatory effects. I would consider this to be another level 1 subject matter for yourself. So I would keep that in the center. And then you're going to talk about corticosteroids. Okay. Then you have your conclusion. Your conclusion, okay. Your conclusion, when you're forming your conclusion, I want you to be thinking about it as identifying the key or major points that need to be highlighted, things that you learned from doing your research. Plainly identify how your research answered the original activity questions. Put the numbers in there, put the data in there. What did your research prove? What did it indicate? What did it provide? Was there something that was very specific to patients' outcomes if they followed a certain treatment regimen? So your conclusion needs to tie it all together. And your conclusion, when you get that part done, you're going to use your conclusion to help write your abstract, which when you watch that video, or if you watch that video, you heard me talk about that. Your abstract is the very last thing that you write. Well, there's your conclusion. Then you have your references. Your references is another, see it's bold, it's centered, subject matter of reference in the center. Then you have your references. The number of references are going to be related to the required number based on the activity assignment. Typically, we're going to say 3 qualified resources. And so using something like Google Scholar, you're going to look up and you're going to make sure that you have good qualified resources that are credible. You're going to have them alphabetized. And here you're using something called hanging indentation. You're also going to have all of your references. They're going to be double spaced. So when you come here and you look at it and then you look at paragraph, and I can see it is double spaced. So that's appropriate. Nothing's bold. That's looking good. There's the format. It's also alphabetized. C, N, R. Okay? Make sure they're alphabetized. The other thing about your references is if you have it listed here as a reference, it should be listed. Each one of those references should be in the body of the paper somewhere. Okay? I will be looking for that. Okay? As for the reference page 2, I would advise you, coming back to it, look at the video for citefast.com, www.citefast.com. Use that. It is so easy. It'll help construct your reference. It'll alphabetize it, put it in the right format. It will build everything. All you have to do is copy all of your resources at one time and put them into your paper. Just make sure you have it in the right font and the size. And I would tell you use New Times Roman number 12. The other thing too is that if you're using citefast.com, it's going to allow you to give you the in-text citations, which is really an awesome feature for somebody that might not have been writing papers frequently. So you can see how that citefast.com is going to go ahead and give me this citation already filled out for me, and then in the same area, it's going to provide this for me saying, this is your in-text citation. Use that. Now, APA format can get very complicated. We're going to keep it simple. Don't worry about it. Keep it simple. I just want to make sure you give credit where credit is due. Going back to the paper, I'm going to go up a little bit further. And I'm going to talk about some basic things that I think is really important. Your margins, 1-inch margins all around. Your font, I'm going to ask you to go ahead and use New Times Roman 12 font. Make sure you do double space all the way through the paper. So I'm going to come through here. I'm going to highlight everything. I want to make sure that I have New Times Roman. I'm going to do 12 font, okay? And I'm going to make sure that I'm double spaced over here. I'm going to hit paragraph. Everything is double spaced. I'm good. So now my paper, I have my reference page. I have my conclusion. I have the key parts of the paper that are addressing the activity questions. Now what I want to talk about is some key things that you might want to know. What if you want to go ahead and you want to insert a page number? Say you don't have the template and you're trying to insert a page number. Not a problem. Come up here, click Insert, come all the way over here to Page Number. Click here where it says Top of the Page, and then pick Plain Number 3. Okay, and that's going to put it to the right-hand side just the way you want it, and that's where it is. Okay. There's your title. There's your subject heading. Okay. Your title of your paper, again, I'm going to mention this. You can see it's capital T for treating, capital A for acute, and capital A for asthma. Well, what is that? That's called the title case format. And title case format is when you're using that format for a particular title in your paper, you have to capitalize all the important words. So treating, acute, asthma, each one of those words is important, so they're capitalized. We've talked about inserting page numbers. We know your first page is the title page, second page is your abstract. I'm requiring it so you can get into the habit of it, even though it's not always required. Check with your professor. And then page 3 is the body of the paper. I'm asking you to include an introduction, general summary of what you're going to be reading. And then the other part is everything is going to be double spaced. Your paragraphs are all going to have a 1/2-inch indentation. Okay. What else? I want to make sure that you have there's one space after each punctuation. Make sure that you look for that. You don't want to have multiple. The other thing I'm going to point out too is that your punctuation should be at the end of all your sentences. So like this sentence here, one common and often preferred form of treatment is the administration of bronchodilators. Okay, there's a period right there. Great. Okay, that's appropriate. If it was a question, it'd have a question mark. Then it should be one space afterwards. Okay, one space between the punctuation and the start of the next sentence. Well, when you're putting your in-text citation, notice that there is no period here. The period goes after the citation. It's the last name, comma, and the year of print. And there's your parentheses, and then the period. That's appropriate. You only need to put it one time. You don't have to have it multiple times throughout the paragraph. As long as you have it towards the end, if that's where you got the information or where you paraphrase the information, you're giving credit. That's good enough for me. Okay. The other thing I want to look at, I want you to be thinking in terms too of making sure you don't write in the passive tense. I'm going to go ahead and put an example here in the paper and kind of explain what I mean. Go home, I'm going to go to the left. I'm going to put this in here. And this is active and passive writing. And I'm saying no passive writing for your paper. What is passive tense writing? You're putting the object first. I want you to write using the active tense. And that's where the subject is first, or the thing that does the verb. What does that mean? I would have been lost if somebody tried to tell me that 15, 20 years ago. I'm going to explain to you your sentence type. Here, you have your active tense and you have your passive tense. We have our subject, your verb, and your object. Well, the active tense, the subject is Alan. The verb is rode, and the object is the bike. So Alan rode the bike. Well, the subject is first, the verb follows, and the object is last. If you're writing it in a passive tense, then you have the object first, which is the bike. The verb was ridden by Alan. So if you were to write a sentence, the bike was ridden by Alan, that would be a passive tense, and I would ask you to go ahead and rewrite it in the active tense. Okay, so it's going to take a little while. It took me a little while to understand that, but I wanted to give you that as an example. The other thing too, when you're writing in a formal way, you're not supposed to use contractions. So do not use words like don't and didn't. Stay away from non-formal language. This is a formal paper. Don't use slang or colloquialisms. Refrain from using overly relaxed and familiar language. Okay, you're writing as a highly educated individual on the subject matter. You're a respiratory therapist. You're all registered, so you can use the jargon that's familiar for a respiratory therapist. That's fine. What else I want you to do? When writing numbers, all numbers that are less than 10, I want you to write them out. So if you're going to put a number 1 or 2, write the word number 1 out, number 2 out, O-N-E-T-W-O. We already talked about section headings. I'm not going to go into the details. There's actually 5 different section headings. If you do the 2, I'm good with that. Here is a set level 1 major section heading. Here is a level 2, which is a subject heading underneath a level 1 subject heading. That's good enough. Or you know what? If you used all level 1, I'm completely fine with that too. Okay. If you'd like more information about the 5 different subject levels, I'll be glad to go through that with you at a different time. We've already talked about our conclusion. We've talked about the reference page, going through it. If you would like more information about footnotes, please see me. I'll be glad to do that. I'm not requiring that for my papers, but I can give you information on that. And the other thing too is if you're going to be doing anything with regards to including pictures and graphs and different things like that, well, at the very end, you might want to go ahead and include that as the last page after the reference page. Say you have 2 pictures and 2 graphs. Well, after the reference page, if you had 2 pictures and 2 graphs, then you're going to have 1 page for each of the pictures and 1 page for each of the graphs. So you'll have 4 additional pages after the reference. What's in there? Well, it could be pretty much anything that you think is important that'll help the reader if they want to have additional information on the subject matter that might not have been appropriate to include in the body of the paper. I hope that this has been helpful. If you have any questions, please let me know. And remember, we're not English majors, we're respiratory therapists, but we're going to get better at this. The other thing too I would tell you is make sure that you do, before you submit it, go ahead and take your full paper, and when you go to the home, you might want to hit a review. You might want to go ahead and check spelling and grammar, okay? Go through all the words. I would tell you, I would also encourage you to, see, spelling and grammar check is complete. I would tell you to go ahead and use something like Grammarly to make sure that you've done everything appropriately. Visually do it, then come to your file, and then you're going to hit save. And when you hit your save, you're going to go ahead and create it, and then you're going to put your name of your paper. Use the format that we think that we've showed you that's important. Make sure your name's there, the date, and the module number, so that you get full credit. Save a copy to your computer, upload it to Turnitin, and if you have any questions, you're having difficulties with Turnitin, you can always send it to me as an email attachment to my work email. Okay. I hope that was helpful. I look forward to seeing you in Wolf Den, and I hope you have a great night.